So today we're going to talk a little bit about positive behavior support. And specifically, we're going to talk about dispelling some myths about practice. We're going to talk about what good practice looks like, and also how we can move towards a really holistic, person-centered approach to delivering positive behavior support that takes steps to actively respect and uphold the human rights and dignity of the people that we are so fortunate to have the opportunity to support. Before I get started, I would just also like to pay my respects to the traditional custodians of the land on which we meet today. And I would also like to acknowledge all the expertise that all of you bring to the table. I really, in my work, emphasize knowledge translation. So it's about making information about what works and what people want accessible to practitioners, because it's really about how we deliver these services in real world settings. It's not about what the pages of our peer-reviewed journals have to say. So I have so much to learn from all of your experiences as well. It would be great if those of you that are joining us online could maybe just pop a quick introduction in the chat. It would be great to know where you're joining us from today, and if you're a practitioner, a family member, or what your connection is to PBS. And just to get to know who's in the room today, by show of hands, how many of you are working as PBS practitioners? Good. What about allied health? Parents? Family members? Good. Teachers, support workers. Anything I missed that anyone wants to yell out? Support coordinators. Awesome. So already we can see that there's so many players involved, and that can be wonderful and tricky and amazing and so difficult all at the same time. But it's great to have such a diverse group here with us today. Okay, let's get into it. So there are a couple of learning objectives for the presentation today. The first is just to bust a few myths about PBS and sort of give you my truths, which are all tentative because it can always change. We'll also describe the underpinning principles of a contemporary and person-centered approach to PBS, and really focusing on how we can deliver these services to people who display behaviors of concern that might be negatively impacting their quality of life. And so when I talk about behaviors of concern, sometimes I default and use the word challenging behavior. So I sometimes change the language, but it's about behaviors that pose a risk to the person or others, behaviors that put the person more at risk for social exclusion, and also put the person at risk for breakdown of relationships or negatively impacting quality of life. We're also going to explore some current challenges that are associated with delivering positive behavior support in Australia, and discuss a few strategies that we might consider adopting to build our capability in PBS. This is a really new and emerging space in Australia, and so we're sort of growing the field and growing the profession from the ground up. And so I think there's some things we can do to try to build some systems and structures into the way that we work to really try to emphasize that person-centered practice. So the first myth that I'd like to bust today is that PBS is but one intervention for reducing behaviors of concern. In fact, PBS is a framework. I don't consider it an intervention. I consider it a framework for guiding the delivery of a whole bunch of different supports, interventions, services that are focused on teaching new skills and enhancing quality of life. So we really want to flip the script on looking at PBS as some people that fly in and try to squash a bunch of challenging behavior and then fly out again. It really is about making long-term relationships with people to enhance quality of life. And when we work from this approach, we start to see reductions in behaviors of concern as a side effect, but not as the main goal of the support that we provide. PBS is values-led. So what this means is that within the field, a set of values have been articulated more broadly. The values are that we look to achieve enhanced community participation and social inclusion for the individuals that we support. We look to find ways to give people more choice and control over their own lives. We want to build capacity or build functional life skills that will serve the person well. We want to ensure that people are able to experience respect and dignity and that their human rights are upheld. And all of these things are part of the process. We're not just concerned with behavior change in isolation of the wider community in which a person lives and learns. And so PBS is really a team approach. It's really a team-based framework for supporting a person. Now, these are some general values, but we have to also recognize that these values might not be the values that your clients, your participants have. So it's about identifying the personalized and unique values, goals, and aspirations of each individual that we support and sketching out a plan. Where are you now? What are the obstacles to helping you achieve your goals? And how can we help you overcome any obstacles to do everything that you want to do in life? Next is that PBS is based on a functional approach to understanding behavior. We attempt to understand why behavioral challenges are occurring. We don't just look at what the behavior looks like. What the behavior looks like doesn't actually tell us a whole heck of a lot. We need to go deeper and try to understand what it is that the person needs. What is this behavior trying to communicate? And ultimately teach the person new ways to get their wants and needs met that are more safe and more understandable. And so we use a methodology called functional behavior assessment as a way of understanding the why of behavior. Next is that we don't just focus on reactive approaches. We don't just focus on what to do after the behavior of concern happens. We flip the script and we focus on all the things that we can do proactively to make that behavior obsolete. What can we do? How can we change the environment? How can we teach new skills so that the person doesn't actually need to engage in the behavior of concern because they can express themselves and have their needs met in other ways? And we use skill teaching as a central component of our behavior support plans. So we're looking at strengthening new applied skills that the person will be able to use in their day-to-day life. We achieve reductions in behaviors of concern as a side effect of teaching rather than as our primary focus. We also look to create enriched environments for people to live in. We try to discover what brings people joy in life, and we create contexts in which people can do more of the things that bring them joy. And doing all of these things will help move people closer to achieving what we call better quality of life. And PBS takes a long-term focus. This is an approach that relies on someone flying in, doing an assessment, and flying out. The heart and soul of PBS is about building trusting and supportive relationships with people and having that ongoing presence in the person's life. And a lot of the work that a PBS practitioner does involves coaching. I almost think we should be called PBS coaches. It's about working with a team around the individual to coach in implementation. So we want to know what's working, what's not working. How do we problem solve on the ground to ensure that we're achieving the best possible outcomes for the people that we support? And I get that this is hard in the NDIS space, because there are funding contingencies that sometimes prevent that from happening. But we all have to actively work to change that. Focus on less assessment, more coaching. I really, really believe that's the key. So what is PBS? Well, the NDIS has provided a definition. They use the definition of integrating the contemporary ideology of disability service provision which emphasizes values, human rights, and person-centered approaches with the clinical framework of applied behavior analysis. And positive behavior supports are evidence-based, meaning that there is research demonstrating effectiveness of certain components, and methods that aim to increase the person's quality of life. And again, as a side effect, start to reduce behaviors of concern. There are a lot of different strategies that can be used within a PBS program, and it's individualized. No two programs are identical, which is why I encourage everyone to conceptualize PBS as a framework, as sort of like the house and the walls, that's PBS. Then all the furniture inside the house is all of the different strategies, support, approaches or tactics that we might use. And so some of those strategies might include things like teaching the person safer and more understandable ways of communicating. We might do that using something like AAC or picture exchange communication or strengthening vocal communication, but we recognize that communication can take lots of different forms. It's not just talking with your mouth. The next is looking at providing visual supports and choices. We're just embedding more choice-making opportunity into the lives of people. We're also looking at changing the environment around the person. And this is a really key component of PBS. We look into the environment to discover what's not working for a person and alternatively, what's working well for a person. And we try to help design environments that allow the person to do more of what they want in life. So this could be enriching the environment, putting up, again, visual supports in the environment, using, choice-making opportunities, providing more access to community, whatever it might be. We also try to minimize known triggers. So what that means is through the process of functional behavior assessment, we can identify, well, these are the really difficult times for the person, or this is what the person dislikes, or these are the contexts in which the person is likely to display behavior of concern. And then we have to ask ourselves, is it possible that we can eliminate that trigger? And some triggers, particularly triggers related to what I call environments of concern, which we'll look at in a minute, should be eliminated. But I also like to say that hashtag triggers happen. So our goal isn't necessarily to eliminate all triggers, because then we might be walking on eggshells around the person because we don't want to set them off. It's about teaching them new, safer ways of coping when they're experiencing triggers. So again, we talk about minimizing triggers, but I just add that word of caution that sometimes the goal isn't to eliminate the trigger, but it's to teach the person new ways of coping when in the face of what you might call frustration or adversity or difficulty. We also look to identify a person's personal preferences. So sometimes PBS is criticized for taking too much of a deficit-based focus. In other words, we focus too much on what the person can't do and what's problematic for the person. But I think there's a lot more that we can do to actually articulate how PBS can be a strengths-based approach. And that's through really taking steps to identify what the person prefers and building in more of these preferred things into the person's day-to-day life. And finally, we want to perhaps provide access to items and activities that provide stimulation that's similar to that produced by the behavior of concern. So for some people, we see behaviors of concern in contexts where they don't have much to do, or they want to do something different, they're bored, but they maybe don't have the skills. So what other types of things can we look at building? We might talk about leisure skills or recreation skills that produce that sort of sensory feedback, but allows them to access that feedback in, again, a safer way. Positive behavior support. Oh, myth. Okay, this is another myth. So another myth is that positive behavior support is just about changing the behavior of the participant or client or student, direct recipient of the services. In fact, PBS is a team approach, and your behavior support plans are likely to be effective if a whole team is able to get on board and implement. And so coming back to this idea that a big component of the job of a PBS practitioner is building the capability of others to support the person. That's where your expertise really sets you apart. You're a coach. You're able to be there on the ground, working with staff to identify staff, support workers, families. There could be a lot of different players on the team, actually looking at what works, what can we do differently, and how can I empower you as the people around the participant to support them in a way that's going to meet their needs. So let's look at how we might adopt a team approach. But first, let's look at this concept of environments of concern. Sometimes when we're supporting a person, we come in, we do some observations, we kind of check out the place where they live or work or learn or whatever context they're in, and we actually realize that it's a pretty crappy environment. Put yourself in the person's shoes. Is this how you would like to live? So I define an environment of concern, and I will give a shout out to Jeff Chan from the NDIS Quality and Safeguarding Commission because he coined this term. An environment of concern I define as an environment that does not allow the person to have their basic needs met. So are we supporting someone that actually doesn't have their basic needs met for shelter, food, sleep, warmth? People in this situation are experiencing a ton of adversity. The first thing we need to do is get them in a situation where their basic needs are met. There are also environments which are devoid of learning opportunities. The person's really isolated and they don't have much to do. There are environments that are devoid of meaningful relationships and opportunities for socialization. They're devoid of opportunities for recreation and leisure. They are devoid of opportunities to make choices. These environments impose restrictions, and all sorts of positive behavior goes unrecognized and unreinforced. I guarantee you have supported a client that is living in an environment of concern, because what happens as a way to mitigate risk sometimes with clients that we support is that we take things away. We put locks on things. We stop taking them out in the community and friends stop coming over. So what happens is the person's world gets smaller and smaller and smaller. And that's a risk of risk mitigation. So we need to be cautious that we're looking out for that when it happens, and we take steps to fix that first and foremost as part of what we do. Sometimes addressing the environment is the only thing you need to do. And often when we're supporting somebody who we feel is living in an environment of concern, we're actually not there to change the behavior of the participant. We're there to work with the people around the participant who are responsible for creating that environment. So again, this really involves coaching, and you have to ask yourself, who actually is my client in this case? Is it the participant or is it the team? And I would say that often you'll find that it's the team. The next myth is that we can address behaviors of concern without understanding its function. So what do we mean by function? We've already talked about this a little bit, but essentially it's the reason why the person is engaging in behaviors of concern. What are they trying to tell us? What unmet needs does this person have? So a function-based approach to supporting an individual with challenging behavior is really underpinned by the following assumptions. The first is that challenging behavior is often learned, just like learning how to ride a bike or learning how to do the laundry. It also serves a purpose. It's not happening for no reason. There is a reason. And sometimes it's really hard to know what that reason is, particularly when they've had really long, complex life histories, but there is a reason. And challenging behavior is not an innate part of the person. It's not a personality characteristic. It's actually more of an interaction between that person and their environment. There are no problem people. There are just contexts that support behaviors of concern. And sometimes extraordinary forms of challenging behavior can actually develop and maintain under rather ordinary conditions. Now, I would say living your whole life not being able to communicate your wants and needs is an extraordinary condition. But to an outsider, it might look pretty everyday. This is just you. You just don't have the ability to communicate. You just don't have the capacity for communication. But in fact, there are so many ways that we can teach someone to communicate that meets their needs, it's at their level. Ultimately, the answer to how to help people with their challenging behavior lies in understanding the function or the why for that person. But I also like to put in another caveat here. Sometimes challenging behavior is actually a very adaptive response to a very maladaptive environment. We may not know, but we think that individuals with disability may have a higher likelihood of experiencing adverse life events or traumatic events. And challenging behavior serves them well in the face of adversity. To us, here and now, it might look very maladaptive, but we need to stay curious and recognize that those behaviors were very adaptive. And this can be the same for individuals who are experiencing family violence, individuals who are experiencing neglect, food insecurity, refugeeism. This is really applicable to a lot of people that we might support in our roles, even if they don't have a significant intellectual disability or communication delay. So what happens when we try to change behavior without considering its function? I would say, well, first of all, there's a tendency to blame the person for their behavior. We might say things like, he's just a bad kid, he's just a hyper kid, or he's just a frustrated kid, or he doesn't belong in this classroom. And it can lead us to look for more exclusionary type solutions because we think it's hopeless. We think, well, it's just how they are. There's nothing we can do. When we try to change behavior without considering function, that's when I say we're engaging in what I call behavior modification, behavior mod. And I think sometimes people think that this is positive behavior support. They might think that positive behavior support is just sort of arbitrarily dispensing rewards when somebody does something good and punishers when somebody does something that we don't like. And yeah, we can change their behavior. That's not what we do. That's behavior mod. That's like circa 1970. Can we please leave that in the past? It really is with the advent of functional assessment that we've been able to create positive behavior support. Because functional behavior assessment has given us the tools to understand the why. And so we don't arbitrarily try to change somebody's behavior by shifting what it looks like. We never try to take away a behavior without teaching a new skill, a replacement, a functional replacement behavior. And that's really the heart and soul of positive behavior support. When we engage in behavior modification, we might be more likely to default to things like medication, hospitalization, restraint, and seclusion, because it seems like we just need to mitigate risk and try to squash that behavior. That's the main thing. But these types of practices, when used in isolation, because I'm not going to stand up here and advocate for the elimination of restrictive practices. I actually think in some cases they are necessary. But if we use them as our main strategy, they will not produce long-term benefits for the person. And overall, we're not promoting the well-being of the person that we're supporting. So again, what is a functional behavior assessment? It's not a manualized approach. It's not a book that you can pick up and do word for word. It's a decision-making process. It's a way of discovering the why. So it's really helpful to use the iceberg analogy. So when we think about topography, behavior topography, we're looking at just what the behavior looks like, the form. We can act it out. And that's important because we need to know for consistency, what is the behavior that we're looking at, and can we collect some data on that? Can we measure it? Can we be sure that our behavior support plan is working? But the more important part is to go under the water and look for the why. We can't know this. We can't know the why just based on what the behavior looks like. Because two people could engage in the same exact looking behavior, but they serve completely different purposes, completely different functions. Or two people might engage in behaviors that look really different, but they in fact serve a very similar function. So functional behavior assessment, again, is our problem-solving guide. We have a lot of different tools or assessments or things that we can use to try to get to the why. So generally, when we're talking about functional behavior assessment, we're looking at a combination of what we call indirect assessment and descriptive assessment, or direct observational assessment. So indirect assessment would involve no direct observation of the client, but we might be asking people who know the client about what's going on, or looking at records or previous behavior support plans, whereas direct observation allows us to actually spend some time in the real world with the client and observe what's going on. What does the behavior actually look like? How often does it happen? What are the contexts in which it occurs? And these components should be thought of complementary, not substitutable. It's important to do both as part of the process. But I always advocate for what I call, I don't know if this is a good way to talk about it, but quick and dirty FBAs. We want to get some good information quickly that's going to allow us to get on to behavior support, but also recognizing that the FBA is an iterative and ongoing process. If we can adopt what I call functional thinking and always take a functional thinking approach when supporting a person, things might change and we can sort of capture that, tap into that over time. So think of your FBA as a beginning step, but certainly not the end goal. So like I said, indirect assessments could include things like record reviews, rating scales, questionnaires, interviews, or any method of gathering information from others who know the individual. Here's an example of an indirect assessment tool that you might be familiar with. This is called the Questions About Behavioral Function, or the QABF. And this is a tool that the NDIS often talks about when they talk about functional behavior assessment. Now, something like a QABF, it's a checklist. So you could kind of you could sit down and do it with someone as sort of a quick interview, or you could give it to someone and ask them to fill it out. Basically just go through and say, here's a statement. How much does this apply to the participant? Never, rarely, some, or often. And then we can tally up the scores and see, what function do we think's going on? Like, what category does this behavior sort of fit into? And they can be quite quick to implement, but they're really problematic. And they're really problematic because most people's behavior and function doesn't fit so nicely into one of these boxes on a checklist. So they don't actually allow you as the practitioner to discover what I would call the unique and personally relevant contexts and events that are influencing this person's behavior. It could be helpful to use as like a preliminary screening tool before an interview, just to get people thinking about behavioral function. But I really caution against relying on something like a QABF as your main method of collecting a functional behavior assessment. They don't give you enough rich information about the person to design an effective behavior support plan. Now, I really advocate for the use of something called an open-ended indirect assessment. This is the type of assessment where you can ask open-ended questions and you can elicit a lot of really rich information about the person. And you can conduct it in such a way where it taps into the person's strengths. So we can start to make the FBA more of a strengths-based assessment, not just focusing on deficits. So you might ask questions about, well, what is their communication and language like? How do they communicate? What are their preferred people, places, and activities? When, with who, and where are behaviors of concern most likely to happen and least likely to happen? Here's an example. I'll distribute the slides because this is a little bit hard to see, and also it got a bit distorted. But essentially, you can look at, how do they tell you that they want your attention? Is it through words? Is it through gestures? Is it through facial expressions? Or is it through punching you in the face? How do they tell you that they want help? Do they ask, or do they throw a chair across the room? How do they tell you that they want to get away from something? How do they tell you no? So you can start to learn a lot about possible functions, possible whys. So something like this can be really helpful to guide an interview. It can also be really helpful as kind of a first step in getting to know the participant and others, just to learn more about, well, what is the behavior of concern? We do need to know what it looks like. We do need to know how often it happens. Is this happening every day, multiple times a day, or is this happening once in a while, but the risk is really high? The person's at risk of getting arrested when this behavior happens. Like, good information to know. We can also ask whether behaviors are likely to happen together. Do we have like clusters of behavior that sort of hang together? We also can ask about background variables. Sometimes in technical terms, we call these setting events, but they're things that kind of just vibe in the background that may or may not be influencing behavior at any given point in time. So sleep is a great example. It could be that after a really good night's sleep, we see a lot less challenging behavior and a lot more active engagement. Or it could be that after the person has a really disrupted night's sleep, thanks. Or it could be after a really disruptive night's sleep, we see a lot more challenging behavior, particularly when the person is asked to do certain difficult things. So maybe if we know a little bit more about sleep and we can, I guess, think about that from day to day when we're supporting the person, we might be able to help tap into, okay, what is this person's window of tolerance today? Should I take them out and go into that really busy shopping center and do all those sorts of things? Or do we need to kind of lessen the demands, lessen the activity level today, and give them a little bit more chill out time because they didn't get a good night's sleep last night? Things like diet, medication, particularly if medications have side effects. This is all good stuff to know about because these are all more, I guess, contextual variables that can influence the occurrence of a behavior of concern, but they're not always the same. They can fluctuate. We also want to know more about the context. So coming back to this idea of when is the behavior most likely to occur, where, with who, and during what activities, but not just when is behavior of concern most likely to occur. When are they at their best? When do they seem happiest? When are they really thriving? That's really useful information. And that also can help us shift the focus to one that's more strengths-based. We can also ask about their schedule, their daily schedule. So tell me what the daily schedule looks like. What are the things that they really enjoy at different times of day? And what are the problem times? What are the things that seem to be difficult? This can be really useful. It can also be really useful for you as the clinician to know when you might want to go in and do a direct observation or spend some time with the client, because perhaps you need to structure your time to actually go in and see what's going on during really difficult times of day. So you can be more strategic with sort of working out, when do I want to go spend some time with the client? What types of things do I want to see in action to give me the best information? And then we also talk about consequences. So consequences are essentially any environmental change that happens immediately after a behavior. What do others do to help the person calm down when they're having a particularly hard time? What do other people do immediately after a behavior of concern happens? What do peers do? Or is it really unclear? Sometimes I'll say, if I had to give you $1 million right now to turn the behavior off, make it stop, what would you do? You can often get some pretty good information about what the person might be trying to communicate and how people sort of respond in that moment. Consequences are really important. Although we spend quite a bit of time in positive behavior support talking about the environment and talking about things that happen before behavior or triggers, motivation, it's really critical to have an understanding of just how powerful consequences are in shaping and maintaining different types of behaviors. And our job when we conduct an FBA is to identify, if I was to say, the communication purpose. What do they want from you? What are they trying to tell you? The answer to that question is usually the relevant consequence for that behavior. So generally, when we talk about functional behavior assessment, we're sort of looking at 4 what I call big functions. So we have sensory feedback, behaviors that produce forms of sensory stimulation. In other words, another person isn't sort of delivering the consequence. The behavior directly produces the consequence. We talk about escape or avoidance, so getting away from. We talk about attention or getting access to. And we talk about tangibles, which is getting access to materials, activities, that kind of thing. So we can kind of loosely say, well, these are the big 4 functions. And there's like all these memes and things like this that you can find on the internet. But when conducting an FBA, your job is to identify which one of the 4 functions is maintaining the behavior of concern. I say it's a myth. Here's why. One-word descriptions of functions do not give us enough information to build an effective behavior support plan. Actually, really like this meme, or what do you call this thing? Is it a meme? Whatever it is, from the internet. I didn't make it. We need to know more. When you're conducting a functional behavior assessment, your job is to identify the unique and personally relevant function for each person. And everybody has a unique learning history. So everybody is likely to have different reasons why they engage in specific behaviors. So I like to say that there's an endless number of possible functions when we really drill down into the unique and personally relevant variables for each person. So although we might say it's escape, I want to know escape from what, when, who delivers the escape, what do they do when they're not doing that thing that they're escaping from? I need the answers to all of those questions to really get to the unique and personally relevant function for that individual. But we do have to be careful that we don't chase the cause inside the person. So let's look at the example of anxiety, because we often hear, why is he behaving that way? Because he's anxious. We're saying that it's something coming from inside. I would like to propose an alternative explanation. I think that anxiety is actually just a summary label for a constellation of public behaviors and private events. So what do I mean by private events? I'm talking about things that happen inside the skin that are only accessible to the person who's feeling them. These could be things like an increase in heart rate, feeling hot, feeling butterflies in your stomach, feeling like you're feeling a sensation of fear. These are things that you wouldn't know necessarily unless the person told you how they were feeling on the inside. And public behavior. So you might actually look at someone and say, oh, they look really anxious. Well, how do you know? Well, they're trembling, they're having difficulty finding their words, they are, running out of the room down the street, whatever it might be, right? So instead of attributing the behavior to the anxiety, we recognize that anxiety is it's a summary label for a constellation of public and private behaviors, but we still need to identify what's causing the anxiety. And to do that, we have to look further back into the environment. We have to go back to asking questions, being curious, observing the person, and looking at those environmental factors that are influencing that behavior, that emotion that we call anxiety. So the next myth is that when addressing behaviors of concern, all you need is a functional behavior assessment. It's the magic bullet. In fact, the FBA is just the first step in the process. And ultimately, the purpose of the FBA is to inform the design of a function-based and skill-based positive behavior support plan. So when we use the term function-based, we mean that the support strategies are directly linked to behavioral function. In other words, we're actively teaching functional replacement behaviors. And skill-based just means that we're emphasizing the teaching of new skills. And research has consistently shown that the very best ways to produce sustained, meaningful, and long-lasting reductions in behaviors of concern is through the teaching of new skills. So this brings us to a behavior support plan. What is it? Well, it's not what the NDIS wants you to do. Sorry, is that controversial? It's a living, breathing, and active set of strategies that focus on identifying what a good life looks like for the person, helping the person do more of what they want in life, creating a more enriched living and learning environment around the person, helping the person communicate their wants and needs in safer and more understandable ways, and ensuring, most importantly, that the other people around the person can respond to their communication. Because how frustrating is it for you to communicate and no one ever listens? So what makes for a good behavior support plan? Well, it's safe. It does take steps to maintain safety. It's effective. So we have data, whatever that means, to show that the plan is actually working for the person. It's helping the person. It's practical. It has to be useful and practical. In other words, it has to be contextualized, relevant, and focus on the things that are important to the person, but done in such a way that the people who support the person can actually implement it. And sometimes this means we can't tackle everything at once. We have to pick the one thing. And finally, it needs to be viewed as acceptable by the participant and others. So we have to tap into the person's values, goals, needs, and strengths to ensure that the plan fits them. So a BSP is about looking for ways to change the environment around the person. So you can consider it sort of a description of strategies. First thing we want to do is, well, is this person in an environment of concern? Is there more that we can do outside of the person to create a better living and learning environment? It's about coaching others to support the person in a way that works well and meets the person's needs. It's about supporting the person to communicate their wants and needs in safer and more understandable ways. It's about helping the person do more of what they want in life. And lastly, it may involve the use of restrictive practices. It may involve the use of other reactive strategies that are needed to help keep the person and others safe. I think person-centered planning is the key to bridging the gap between the FBA and the behavior support plan. And so I'm not going to get into a ton of detail about person-centered planning, but essentially it means adopting a person-centered approach to actively include the person and others in the planning process. And so through a person-centered planning type of activity or session, you can really identify how it is that a person wants to live their life and be supported and what is required to make that happen. And the overall aim is to result in real positive change for the person. And ultimately, the development of a behavior support plan that is viewed as, yes, acceptable, it's meeting my needs and all that good stuff. So it's something that you do in a team, rather than you in isolation behind a computer. And so there are a couple of different models of person-centered planning that you can have a look at. One is called MAPS, and it involves essentially sketching out a map. We're going to talk about where do you want to go? What's the pathway to get there? What are the things you want to do more of? What are the things you want to do less of? And what are the specific obstacles? And we just work as a team. We're going to sketch it all out in a way where it's really visible and transparent to everybody involved, and we can get the input of everybody involved. And then at the end of the person-centered planning session, we have an action plan. We can actually start to delegate to different members of the team who's going to take the lead responsibility for this action, who's going to be responsible for this action. And that can really help facilitate interprofessional collaboration, which can be really tricky. It's giving clear roles and responsibilities and accountabilities as part of the process. Another one is called paths, very similar. It just involves working as a team with a big piece of paper out on the middle of the table and sketching out what a good life looks like for the person. How are we going to get there? Get everybody's input. I mean, if the participant can participate and actually lead the conversation, even better. So you can check these out online, and there's some courses that you can sign up for to learn more about becoming a person-centered planning facilitator and whatnot. So it's definitely, I think, a key that can really, really enhance the work that we do. What about restrictive practices? So the question then becomes, with all of these other strategies in place, do we still need a crisis response or de-escalation or risk management plan? Sometimes, yeah. Often we're called in to support after the individual has experienced a lot of not so successful services. And all that time that they've been experiencing not so successful services, they've been practicing challenging behavior. And that behavior has become more embedded and strengthened. So sometimes things go from 0 to 60 really fast. And safety is critical. So if problem behavior or challenging behavior is dangerous, if it poses a risk to the person or others, yeah, you probably do need a risk plan. You probably need to consider what you can do to keep the person safe. Now, what I will say is that the main focus of the use of the restrictive practice is not to serve as a therapeutic intervention. This is not the behavior support plan. It's not the long-term solution. It is something that you do in conjunction with the therapeutic supports. So we never want to implement a restrictive practice in isolation. So a restrictive practice is defined as any practice that has the effect of restricting the rights or freedom of movement of a person with disability. It may involve things like physical restraint, chemical restraint, mechanical restraint, environmental restraint, and seclusion. Now, I know that these definitions are tricky, and I know that there's still confusion out there about what actually constitutes a restrictive practice. So we're starting to do some research around this at Monash. We're actually launching a survey for behavior support practitioners to tell us more about their experiences with positive behavior support and restrictive practices, so we can start to help better, provide resources and decision-making tools for behavior support practitioners when they're in this really complex space. So I know that the definitions are not perfect. The reason why the NDIS Quality and Safeguarding Commission exists is because historically, restrictive practices have been overused and misused, and they have directly impinged on the human rights of people with disability. There are a number of reasons why a restrictive practice might be overused or misused. It can happen when people don't know that what they're doing is considered a restrictive practice, and that's okay. This is part of the learning journey for all of us. It can occur when there's no systems in place to ensure that the use of the restrictive practice is documented and evaluated so that we actually can take steps to reduce the use of it over time. It can occur when the main goal of behavioral support is just to make the person easier for other people to manage. And it can occur when people are not aware of alternatives. They're not aware of other ways to build a person's skills or reduce behaviors of concern that don't involve the use of a restrictive practice. So I think restrictive practices it's difficult because people often don't want to talk about them. Or there's this fear that they're going to get in trouble if they used a restrictive practice, or that the NDIS is going to come after you and strip your regulation or whatever it's called. The NDIS Quality and Safeguarding Commission is not here to outlaw the use of restrictive practices. They're not here to fully prevent their use, although that's an amazing pie in the sky goal. I don't think that that's ever going to happen. The goal is to ensure that if a restrictive practice is used, it is used in a safe way when needed, and that organizations have steps to evaluate and attempt to reduce their use over time. The NDIS is about making sure that we're not using the Quality and Safeguarding Commission is about making sure that we're not using restrictive practices in the absence of all the other things that we should be doing involving functional behavior assessment and positive behavior support. So again, talking about restrictive practices may feel really uncomfortable. And so we often don't want to have these conversations, or we don't want to, make people feel bad that maybe they're using restrictive practice and, I don't know if it's my place to say anything, so I'm just not going to say anything. We owe it to the people that we support to get comfortable talking about restrictive practices and make the use of restrictive practices a normal part of our team meetings, a normal part of how we talk to parents. But it's important to do it in a way that's compassionate and not shifting blame, not making people feel like they're doing something wrong. Otherwise, people aren't going to want to talk to us about it. So the National Framework for Reducing and Eliminating the Use of Restrictive Practices in the Disability Services Sector has been published to provide some preliminary guidance. The reason why reducing the use of restrictive practices is highlighted in the Australian context is because Australia has signed and ratified a treaty called the United Nations Convention on the Rights of People with Disability. This means that Australia has a legal and ethical responsibility to take steps to uphold people's rights. And restrictive practices do impinge on people's human rights. It doesn't mean that we can't use them. It just means that we have to use them in really safe and controlled ways. And the national framework also outlines change processes, which put ownership on organizations, leaders, to come up with systems and structures within their organizations to look at ways to evaluate the use of restrictive practices in the spirit of reducing them over time. This isn't something that is at the level of the sole practitioner. This is more systemic work that needs to be done within organizations. So under what conditions might a restrictive practice be used? We would want to use them in collaboration with a functional assessment, a positive behavior support plan, the participation of the person and their family in designing those supports, the informed consent of the person if they're able to provide that informed consent, or family guardians. We want to have systems in place to build the capacity of support workers and family members to implement the behavior support plan. We want to have systems in place for building the capacity of support workers and family to safely and consistently use the restrictive practice. People need to be trained on how to implement these safely and correctly, because a side effect of their improper use is that people have died. We need to have systems for recording and analyzing data to ensure that the positive behavior support plan is working, or equally as important, detecting when the positive behavior support plan isn't working. And we need to be accountable to that and make changes. And finally, systems in place for recording and analyzing data on the use of the restrictive practice. So a restrictive practice may be used, but I would argue only under the conditions that all these are in place or steps are being taken to put all of these in place. Now, I want to talk a little bit more about quality of life, because behavior support in the NDIS space is really about improving quality of life for the participants that we support. So what actually is it? It sounds nice. I don't actually know what it is. So I had to look to the World Health Organization for a definition, because historically quality of life has been a health concept used in medicine. And it defines, the World Health Organization defines quality of life as an individual's perception of their position in life in the context of the culture and value systems in which they live in relation to their goals, expectations, standards, and concerns. So it's a broad-ranging concept. It means a lot of different things to a lot of different people. It can be influenced by a person's physical health, psychological state, level of independence, social relationships, personal beliefs, and their relations to salient features of their environment, right? Easy. You guys can do that, right? It's hard because quality of life encompasses all of these things. It's everything. So how do we show, as part of the delivery of positive behavior support, that we're improving quality of life? That's a big question to try to answer. It's challenging to measure quality of life because it involves so many things. First of all, it involves actually knowing what constitutes a good life for a person, and that's very individualized. It involves understanding that people may or may not share the same views about what constitutes a good life. The participant that you're supporting might have a very different view of what constitutes a good life than you do. There are some aspects of life that may be more important than others in determining quality of life. Could be that there are some aspects of life that can be said to universally contribute or universally detract from quality of life. To what degree do people's own perceptions determine how we consider their quality of life? How do social and cultural factors influence quality of life? And what are the best ways to measure quality of life? These are all questions that we don't have answers to. There's no research that shows answers to any of these questions. So it's a really difficult construct. There are some traditional measures or methods for measuring quality of life. One is called the WHO-QOL, the World Health Organization Quality of Life Survey. I don't know. Really, it's just a list of close-ended questions, and you simply record how much that statement applies to you. So how satisfied are you with your transport? Very dissatisfied, dissatisfied, neither, satisfied, or very satisfied. And it's just a list of questions. It's like a 1,000 pages long. So A, really, that's going to take a lot of time. And B, how dissatisfied are you with your transport? Well, I'm really dissatisfied. Okay, next question. So what do we do? Like, how do we use that information? Again, these types of questionnaires are problematic because they don't allow you to discover the really rich and unique things that are going on for a person. So maybe it could be used as sort of a general screener or guide, but we shouldn't rely on these as our main tools. I mean, it's also the fact that the individuals that we support, they might not be able to participate in an interview like this. So what, they just don't count? So I think we really need to spend some time rethinking ways to assess quality of life for the participants that we support. I think instead of a one-time thing that you do or an assessment that you do once a year, we need to make discussions about quality of life an integral part of every aspect of support, from the initial person-centered planning to setting goals, through designing the behavior support plan, and then evaluating the effectiveness of the behavior support plan over time. So what we need to understand is that this is going to be a very individualized process for each person. So I think we can start to conceptualize person-centered goal setting as one way to start to build in conversations about quality of life. So as part of our goal setting, we want to ask, what is the person not doing that they actually want to do? What does the person want more of in their life? Who does the person want to spend time with? And where does the person want to be in 6 months, 1 year, 5 years? So here are some examples of personalized goals that might sort of be related to quality of life. These goals aren't just challenging behavior will decrease by 80% of its baseline level. We're talking about quality of life. And we're talking about now some tools or frameworks that you might be able to do some quality of life sort of thinking and planning with the participant or with their team, family, as part of the process. So here's one example of a tool you could use. This is called the Life Trajectory Worksheet. And the first 2 boxes, you can kind of think of this. I don't know how many of you are familiar with ACT, acceptance and commitment therapy. You can kind of think of this life trajectory worksheet as like a choice point. What are the things that take you toward the things you want to do, the things you value? And what are the things that take you further away from the things you want to do and the things you value? So think about with your participant and their family, what are the previous life experiences that the person has had that helped move them closer towards living the life that they want to live? And what are some of the previous life experiences that they've had that's actually moved them away from living the life that they want to live? That's where you start. So now you have 2 arrows. You have a toward arrow and you have an away arrow. So in the middle is where I am now. Here's where we are today. So if we follow the toward arrow up to the middle box on the top, we're asking ourselves, what are the future life experiences that I want to have? And if we follow the away arrow and look at the box in the middle on the bottom, what are the experiences that you want to avoid? What are the things that you don't really want to have happen? And from there, we can continue to follow the arrow to the big box all the way over on the side here, which says vision for a good life. And you can just use this as sort of a way of framing a discussion around quality of life. And then what do you not want on the bottom? So this can be something that can be done as a team in the context of a person-centered planning session. And hang on. Here's an example. So I'll send out the slides and you'll have this example, but it just shows you Ben's life trajectory. And Ben has sort of populated the things that he wants to do more of, the things that haven't worked so well. So it's really interesting to note that for Ben, things that didn't work well for him were being in a special education setting with low expectations, having a paraprofessional or a support worker that was just always glued to his side. Like Ben wants more independence, pressure to be doing things in a segregated setting, having to be on antipsychotic medication, which made him feel like really snowed, having scoliosis, seizures, and other physical barriers. Now, some of these things we can't take away, but perhaps we can talk more about how we deal with them in our everyday life. We also see that Ben doesn't want to be just sitting at home all day watching TV. He doesn't want to rely on paid supports as his only relationships. He doesn't want to just eat unhealthy food. Gosh, Ben sounds like me with this unhealthy food. He doesn't only want to eat unhealthy food. Really, Ben? Really? But from here, we can start to look at, well, what are the things Ben wants to do? He wants to be out in the community. He wants to volunteer. He wants to make more friends. He wants to get involved with the fire station. So now we can look at what are the things that Ben wants to do. He wants to spend time with family and friends. He wants to have a girlfriend. He wants to go on vacation. He wants to get tattoos. Yeah, I'll come and get tattoos with Ben. So all sorts of things that he wants to do. Although some of these things might not align with your values, you might not want to get a tattoo, but we need to support Ben because these are his goals and his values. Here's another framework called the Life Course Integrated STAR that you can use for support and service planning. So here in the middle, we start by looking at what do we currently have? This could be, what are the supports that we currently have access to? What are my strengths? What are my assets? What do I really like about myself or have to offer? What about technology? What technologies do I have access to? What can I use to become more independent? What about community? What do I have going on in the community? And also, what are the relationships? Who are the people around me? So we can, again, use this as a bit of a guide to talk about what's going on for me right now, and then where do I want to go? So let's look at Ben again. Here we have Ben in the middle, Ben's services and supports. When we started working with Ben, we only had established relationships with mom and dad. And Ben had eligibility for specific services, specifically NDIS. This is hypothetical, by the way. This is not a real person. Eligibility specific NDIS funding for support workers, and also looking at ways to connect him with informal supports. So then we made a calendar of Ben's life, his weekly schedule. And we see that in the morning and the evening, he's supported by mom and dad. And in the middle of the day, he is supported by some support workers. But there isn't much going on beside that. He's home. He spends a lot of time at home. And a lot of the things on that previous chart about what he wants to do, he's not doing. And we know that because we've talked to him. We've sort of sketched out his weekly calendar. So here's kind of where we're starting. And we're using his calendar almost as a way of sketching out what a good quality of life could look like. So the next thing we do is we start to answer some more of the questions. So we start to build in, well, who are the other people that he could potentially have relationships with? Siblings and friends. What are his strengths and assets? What technology is he good with that he likes to use? What kind of community-based activities can we involve, and so on and so forth. We also look at, well, are there other supports that we can tap into that we're not currently tapping into? And now we start to build his calendar in a way where it's more full. We're actually being more specific about the types of things that Ben might do in his week, his week. So we've specified the times of day when, Ben is probably going to spend some time at home. But when he's at home, we're going to let him he has access to his iPad. We're enriching the environment, ensuring that there's fun, leisure, and recreational things for him to do, more than just watching TV. But now we're looking at volunteering. So we've identified an opportunity for him to do some volunteering at the fire station. So now when he's with his support workers, there's more of a plan, there's more activities. And these are activities that bring value to Ben's life. So we're starting to enrich his calendar. We've also put in some evening events with friends. So more community activities. We're continuing to think about what more can we do? What more can we add? And now we actually are able to make his calendar even richer. We're able to look at ways to build in even more life activities. So in addition to volunteering, there are some lunch outings with his support workers. There are some we have chill time, stay at home, chill, watch football. There's some joining a community sports league and being able to go out and meet new people and play footy. I don't know, American football, I don't know. So there's all sorts of new things. And we're just using this as a way to sort of build a weekly schedule or a way to get people more actively supporting him day to day. And it could be the case that Ben sometimes doesn't participate. Sometimes he's not able to do all of these things. And maybe what we can do is during the week when he participates in an event or an outing or whatever it is, we just tick it off. Like, yeah, he did this. Awesome. He did this. And then when something he chooses not to do, we circle it. So over time, we can kind of look at, what is Ben's life all about? What is he doing? What is he not doing? Where does he need more support? And this becomes a way of sort of looking at Ben's quality of life in a way that's really individualized to Ben, his values, his needs, and his preferences. So I'm going to finish up by talking about what I think are a few key future directions for PBS in Australia as I start to lose my voice. So the question is, where do we go from here? We have to remember that PBS is not one thing. It's not one intervention. It's a highly individualized and person-centered approach to supporting people to live their best life. But there aren't enough practitioners. The demand for PBS is higher than the current supply of practitioners. So we need to look for ways to build the capability of the disability workforce to deliver person-centered, strengths-based, human rights-based PBS. How do we do that? Well, we need more TAFE and uni courses. So if anyone wants to start a course, that'd be cool. We just need more opportunities for people to get professional development and upskill, and that has to be at so many different levels. We need entry level, we need mid-level, we need sort of advanced level. We are looking at designing a national PBS curriculum so that we can actually get some consistency with how content related to PBS is taught across TAFE and university, so that we can ensure that people are coming out of courses with some requisite sort of knowledge and skill. That's still a work in progress. We need to build more capacity within organizations to make sure that PBS practitioners feel supported and well supervised, because a lot of people might be coming into the PBS workforce new or making a career change, and they're going to need supervision and support because we're dealing with people and we're dealing with risky behavior and we're dealing with people's lives. And so that element is going to be really critical to maintain quality. We really need to be accountable. There's a real need for practitioners to be accountable for the services that they provide, to make sure that when we're taking a client's money, we're delivering value to that person. So I think we need to look at ways to incorporate more data collection analysis into our ongoing delivery of the program so that we can actually detect when things are working really well, what we should do more of, and equally as important, when things aren't working well and we need to make a change. And we need to continue to shift our approach from a reactive approach that focuses on simply reducing behaviors of concern to a proactive approach that builds skills and enhances quality of life. So here are some ideas that I have for ways we can start to do this. The first is for organizations to explicitly adopt a human rights focus in the services that they provide. There are a couple of ways that we can start to do this. The first is for organizations to ensure that all of their staff receive induction training on the United Nations Convention on the Rights of People with Disability. What is it? And what does it mean for Australian practitioners? The second is to develop an organizational policy that describes the steps that your organization is going to take to respect and uphold the rights of your clients and make that public. Make that freely available on your website and give it to all of your clients. And as part of team meetings, we need to make discussions about upholding the rights of our clients a regular part of our team discussions. So we always need to be thinking about, what are we doing that could be viewed as impinging on this person's human rights? And how are we going to keep that as part of the conversation and keep thinking about how we can reduce that? It's not that we can necessarily eliminate all restrictive practices, but we just need to keep talking about it. The second strategy is to use active staff training. In other words, organizations have a responsibility for building workforce capability within their own organizations. So we need to look at ways that we can incorporate active staff training. So that's the opposite of what I'm doing today. What I'm doing today is called Death by PowerPoint. Thanks for listening. Active staff training involves things like shadowing your staff out in the real world settings in which they work, role playing, providing feedback, making those things an ongoing part of how you support your staff, not a once in a while thing. Having regular team meetings, all of that stuff should be embedded into the way that the organization works. There's also a real need to invest in developing staff from within, because this can be a really hard job for thinking about supporting our support workers who, are amazing and really like the critical piece in the work that we do. It's a high turnover industry because it's hard. The hours can be unpredictable. They're dealing with behaviors that can be really scary sometimes. So we really have to look for ways to support and invest in our staff's development. The first step is always just developing trusting and collaborative relationships. So staff feel like they have someone they can talk to. When I first started working in the field, I was terrified and I didn't really know how to deal with that. And so I just had a lot of anxiety and hated working in this field for a long time until I was finally able to develop skill and communication and understand how to do this work better. And it completely changed everything. I advocate for something called a participatory supervision approach. So this is the approach to supervision where the supervisor doesn't sort of always tell the staff what they need to do better or what they need to work on. It's not a one-way relationship. It's a two-way relationship where the supervisee or the support worker plays an active role in establishing their own goals for professional development. And the supervisee and the supervisor work together to adjust the professional learning opportunities so that person feels like they're moving towards their goals. So it's sort of like adopting a person-centered planning approach to supervision, in addition to the clients that we support. And we need to look at how we can build these supervision structures into the way your organization operates. So supervision can't be kind of like a side thing that we sometimes do when we have time. It has to be a regular, consistent thing that the whole organization is really committed to. And finally, we need to look at ways to make data collection and analysis a key focus of our work. And this goes hand in hand with this idea that the role of a PBS practitioner isn't just to do an FBA and write a behavior support plan and then see you later. It's about maintaining that ongoing relationship with the participant and their family, and you are a coach. How can you spend less time doing the paperwork and more time doing the coaching? And it's through the coaching and that ongoing relationship that you're going to be able to look for ways to collect sort of data on outcomes. It's not one thing. There's so many different things you can do to collect data, but ultimately this will help you be objective, transparent, and accountable. It'll make it really clear to everybody involved what's working well and what needs to be changed. So coming back to this idea that I think what happens sometimes with the individuals that we support is that we do a lot of things to try to reduce risk, and their world becomes really, really, really small, and their quality of life becomes really negatively impacted. And so I think at its heart, PBS is about opening people back up to the big wide world and giving them all the types of opportunities that you and I would have in our lives. So I always kind of keep that in mind when I talk about PBS. So that is all I have for this morning. I actually got through it all. Thank you, everyone online. You're welcome to email me or tweet at me. Check me out on LinkedIn. And I will be launching a new survey for behavior support practitioners soon. So I'll be sharing that on social media and through other organizations. So hopefully any of you might participate in that survey as well. So I think we have about 10 minutes before lunch, or was someone else supposed to come up and say something? Kelly and Simon are up. So maybe we'll hold on questions and we'll do that this afternoon. Thank you, everyone. Thank you all so much online. Thanks for coming. Now I have no voice. Oh, sure. So at Monash, we offer 2 courses that might be suitable for people that are looking to build skill in PBS. So the first is a short course called Engaging in Positive Behavior Support Practices. This is a short course that we offer through our professional development unit, and it's not a degree course. It's an online self-paced course that I think we estimate about 15 hours of self-study, and that includes a mix of readings and a mix of online activities like videos, text, images, links to websites. And so for people that are interested in kind of developing their capabilities to that core level, they can enroll in the short course and then get a certificate of completion that can be used as part of the evidence portfolio for registration as a core behavior support practitioner. That I think it's about, like, the price just went up. I think it's about like $550 or something. And again, it's not degree awarding, and there's no assessment. It's all just, besides some little tiny quizzes, it's all just self-paced. And then I run a postgraduate course at Monash. So that's a master's level course that actually ends up with people getting a master's degree. It's a master's of applied behavior analysis, and it's a very contemporary, person-centered and strengths-based approach where a lot of what I talked about today, the course goes into in a lot more detail. And it also meets part of the criteria for professionals who may want to consider moving into becoming what's called a board certified behavior analyst, or a credential for practitioners who often do a lot of complex functional behavior assessment and working with clients with pretty high support needs. I also have a lot of students who work in schools, so big focus on supporting the inclusion and participation of kids with disabilities within schools, which is really aligned to Victoria's disability inclusion agenda. And I have a lot of people that work in early intervention as well. So lots of options. You're welcome to email me if you have questions about any of that.
Can I do it remotely?
The masters can also be done entirely online. Yep. So we offer two options. One is a fully online option where you do get some online tutorials, so some online face-to-face time with the teaching team. But we do also offer an on-campus component. So if we have students that are kind of local in Metro Melbourne and they do want to have that on-campus component, we offer that as well. So it's in what we call flexible mode. So students, regardless of where you're from, you can choose which mode of study is going to suit you best. And that one's a lot more content hours than the short course. Oh, thank you. Thanks.
Thank you, Erin. How nice of you.
Erin lost her voice.